Hi, doctor and my friends. So today I'm going to talk about host immune response against the pathogen. So let's move on to the part A, natural human immune response against the pathogen. So before I talk about innate and immune response, I want to talk about the blood-brain barrier or BBB and its crucial role in protecting our brain, especially when it's come to viral encephalitis. First of all, let's understand BBB structure and function. So imagine it as a highly selective security system that surrounds most of the blood vessel in our brain. It's made out of cells like endothelial cells, which line the inside of blood vessels, and astrocytes, which are star-shaped cells that provide support, and parasites, which wrap about the endothelial cell. So together, these components form a tight barrier that control what gets in and out of our central nervous system. It's like the BBB decides who gets a VIP pass into our brain. So it's allowed essential nutrients to pass through but block most harmful substances and pathogens from entering, thus maintaining the brain's stable environment. So now when it comes to fighting infection like viral encephalitis, the BBB plays a critical defense role. It doesn't just stand guard against the virus, it also takes an active part in the immune response. So for example, when a virus invades, the BBB can adjust its security measures. It does this by secreting cytokine and chemokines. So basically sending out signal to call in the brain immune defense team. This team include macrophages, neutrophils, dendritic cells, and lymphocytes, which are key players in the immune system. But here's the catch: the BBB must maintain a delicate balance. It has to let enough immune cells in to fight the virus without causing too much collateral damage to the brain. This involves mechanisms like controlling the permeability of the blood-brain barriers and modulating the inflammatory response. So after the infection is under control, the BBB also help in clean up process. It plays a role in clearing out the inflammatory mess left behind and repairing any damage to the barrier itself. This recovering phase is crucial for restoring the brain to its normal state. So let's move on to the activation of innate immune response. First, the recognition of the virus innate immune cells detect the viral components using pattern recognition receptor. So these PRRs includes toll-like receptors and RIG1-like receptors, which recognize specific molecular patterns on virus. So this recognition triggers the initial step of the immune response, just like spotting the virus. So secondly, interferon production. Upon recognizing the viral components, infected cells and immune cells in the CNS produce type 1 interferon like interferon alpha and interferon beta. Type 1 interferon initiate an antiviral state in nearby cells, making them resistant to viral replication. So they also enhance the antigen presentation and activate others immune cells, including NK cells and macrophages. So just like calling a backup. So third is recruitment of immune cells. The production of cytokines and chemokines by infected cells and resident immune cells creates signal that attract additional immune cells to the infection site. So cytokine such as IL-1 beta and TNF alpha and IL-6 play roles in mediated inflammation and recruiting immune cells. So chemokine guides the migration of immune cells, including the macrophages, dendritic cells, and NK cells towards the area of the viral activity. This step just like gathering the team. So, so for the adaptive immune response, first the action begins when T cells are activated. This happens when they encounter dendritic cells or other cells that present antigen. It's like these dendritic cells are showing a wanted poster to the T cells, telling them exactly who to look for. So initiating their activation process. So once they know what the enemy looks like in the cases of viral encephalitis, CD8 T cells gear up and transform into what we call cytotoxic T lymphocytes. These CTLs are like specialized soldiers trained to seek off and destroy cells in the brain that have been hijacked by the virus. They are targeting and eliminating these infected cells to stop the virus from the spreading further. So we also have CD4 cells, CD4 T cells, so which take on the role of helper T cells. These cells are the strategies directing the battle by secreting chemical known as cytokines. These cytokines are crucial because they signal other immune cells to ramp up their defense mechanism. So CD4 T cells also play a vital role in assisting B cells, another which is another type of white blood cells, so to produce antibodies, specifically designed to target the virus and neutralize its or more marked infected cells for destruction by other immune cells. So also in the activation of the adaptive immune response. But now, when a virus invades, it's the B cells that first recognize the viral antigen because of their unique receptor. Once a B cells bind to its matching viral antigen, it gets activated. Activation alone isn't enough for an effective defense. The B cells needs to transform into a form capable of fighting the virus. With assistance from CD4 T cells, B cells differentiating into two types of cells, which are plasma cells and memory B cells. So, plasma cells are antibody producing factories. Release vast amounts of antibodies into the bloodstream, while memory B cells are immune systems record keepers, retaining information about the virus for quicker and more effective response in case of future infection. So last antibody production, these antibodies serve multiple function serve multiple function alike. They can neutralize viral particles directly, preventing them from infecting healthy cells. They also tag infected cells and viral particles for destruction by uh, other immune other immune and trigger complement system for virus or infected cells lysis. So I gonna talk about the symptoms and sign of the viral encephalitis. So here are the signs and the symptoms for both chronic phase and acute phase. The very common one for acute phase are symptoms headache. Headache is a very common symptom due to the inflammation of the brain and surrounding meninges. And the sign fever, one of the first and most common sign of the infection. So next to the chronic phase, psychiatric symptoms considered more common, which causes mood swings, depression, and anxiety. It's important to note that each symptoms can vary based on the causative virus and other factors such as the patient age, immune status, and the overall health. So that's all for me.